It was around 30th of November 2015 when we first noticed that Phoebe had a lack of energy. She had some pain behind her eye, and that was really the only symptoms that we had, and we were told it was an infection, but upon further investigation they found that there was a tumour behind her right eye. Where it was meant that they couldn't actually operate and take any of it out, and so we were told that the two focal points would be induction chemotherapy followed by some radiation therapy, and then after that we'd have to be on maintenance chemotherapy. At the Children's Hospital, one of the parents asked me if I had considered proton therapy, and at that stage it had never even been mentioned to us.
Proton therapy is a way of delivering radiation treatment. Proton therapy is different to conventional radiation in that the machine technology is different and it's not yet available here in Australia. With conventional radiation treatment, there's a fair amount of radiation that's delivered as the beam enters the patient. And as the beam passes through the tumour, there's further radiation being deposited. So what that means is if this tumour is up against a really critical organ, like the brainstem or the structures that are responsible for vision, we know that those structures will actually get a significant amount of radiation. And for some patients, that can mean blindness or even death in some patients. Where proton therapy is different is the pencil beam of protons can be painted across the tumour. We can take tumours up to a much higher dose with a greater chance of cure for these patients, whilst sparing those normal critical structures, preserving other functions like memory and other organs that are vital for not just survival, but also for development of some patients.
We couldn't live with the guilt knowing the side effects that we would subject Phoebe to if we did go ahead with the photon technology. Things like burns to her face, much higher increased risk of secondary malignancy. There would be growth retardation in her bone structures in her face. She would probably lose sight in one eye and have reduced hearing in one ear. These were just some of the side effects that were mentioned. It was $107,000 US going to the States for proton treatment, and then we had to have 2 regimens of chemotherapy over there, which are about $27,000 US each. And then we had to find an Airbnb and get travel, and effectively went into debt to get overseas, but we had the funds and the ability to get over there, and so we made it a reality.
Certainly it's a treatment that's been very available to patients in North America, Europe and Japan, and over 100,000 patients have been treated with proton therapy around the world. Ultimately, with the proton therapy unit in Adelaide, 800 patients across Australia with specific tumours such as tumours very close to the spinal cord who really can't adequately be cured with conventional treatment in Australia will all receive the treatment that they certainly deserve. Generally, everybody is starting to realise that proton therapy is so essential that the number of patients who will be seeking treatment will escalate very significantly over the next few years.
SAMRI for a long time has been excited about the possibility of developing SAMRI 2, which will accommodate more of our researchers, but most importantly in its basement would have a proton therapy unit. This is the best site for proton therapy in the country. Firstly, our radio-oncologists have led the country in the area of proton therapy. Secondly, we have developed here a biomedical and health precinct which can compete with anything in the Southern Hemisphere. And thirdly, I think just from a transportation point of view, Adelaide is centrally located. People can come from Perth or from Sydney and Melbourne or from Darwin very easily to Adelaide for the treatments. And we have direct flights into Asia. So all of that suggests that this is a terrific spot for proton therapy.
It's really exciting to see that there is some momentum towards getting a machine in Australia. We just need at least one here so that we can treat all of these patients, and that none of these parents that can't afford to get their children sent over there have options, have the best available option in the world for their children. It's not acceptable that people are having to walk away with children that survive and end up with a lifetime of side effects that they didn't need to have.